Here is the agenda and the items that we will cover in today's presentation. Situation, analysis, and background, purpose statement, research questions, operationalization of key concepts, research design, methodology, which will include sampling frame and sampling method and technique, design of the survey instrument, data collection process, potential limitations, and finally a summary at the end of today's presentation. First, I would like to discuss the situation, analysis, and background of this presentation and research topic. Honduras is one of the most violent and dangerous countries in the world, with extremely high homicide numbers, and there is growth of gang violence, particularly among teens in Honduras. Honduras lacks social and community support, and this has had a negative impact, especially on school-aged youth. The current situation in Honduras can be traced back to historical issues with gang violence, illegal drugs, community violence, and political instability. Honduras, since the 1980s, has been under strong military control, has dealt with political corruption and income inequality. While the police have instituted more firm hand policies on community crime, homicides have still increased since the 2000s. This is an ongoing public safety and health crisis, and hopefully literature on the topic can provide more context for the research we hope to do as we study gang violence in this country. Purpose statement. The purpose of this explanatory research study will be to analyze the factors contributing to teen gang violence and the impact on youth in Honduras. The rationale for this assessment is to produce evidence-based research on violence in the city of San Pedro Sula. The main purpose of this study is to examine the factors contributing to rising gang violence and possible community interventions. Research questions. For the purpose of this study, the following are our research questions. What are the significant factors contributing to gang violence in Honduras? What are possible short and long-term strategies and interventions to address the crisis? Operationalizing key concepts and variables. These potential hypotheses are based on the Van Dame 2017 article on reintegration of former youth gang members in Honduras and what social supports could be helpful. The defined variables will be the reintegration intervention or technique the participant was exposed to. The alternative hypothesis would be youth exposed to or who have experienced gang violence who receive reintegration intervention show more positive connection to their communities. The null hypothesis would be youth exposed to or who experience gang violence who receive reintegration do not show positive connection to their community. Fear, trauma, or anxiety are not easily measured concepts or observations, but operationalizing one of these phenomena through participants' self-ratings and rankings or measuring physical symptoms can be operational keys to collect such data. Research design. This study will be mixed methods featuring both qualitative and quantitative design. The sampling technique will be a snowball sampling method where other youth involved in a gang can refer other youth that they know, as well as community leaders or those working at community agencies, helping to make initial referrals. The research will also have an IMIC approach. The goal will be to study gang culture through the lens of gang members and focus on their lived experiences as members of this group. The participants will be assessed through a questionnaire or survey instrument before the intervention to establish a baseline, and then again after the intervention, roughly 10 weeks later. The group of teenage participants who were involved in the gang will be exposed to the reintegration program. Methodology, sampling frame, and sampling method technique. Eligibility criteria for the sampling frame and technique will include teens between the ages of 13 and 18 who are in a gang and currently living in an urban city. For this study, it will be the city of San Pedro Sula, Honduras. Teenagers residing in an urban area where the violence and gang activity are most prevalent will be the participants in this study, and data will come from the perspective of teens who are members of a gang in Honduras. Design of the survey instrument. This study will utilize a verbal questionnaire as its survey instrument to collect data from participants. I have included a sample of some of the questions from the full questionnaire, including an attitude question, behavior question, and knowledge question. Please review the questions. Data collection process. Approval from an institutional review board will be requested prior to the beginning of the field research. There will be at least 8 weeks of data collection total. Open-ended verbal questionnaires will be used in Spanish and with appropriate translation. An all-informed consent will be obtained from all participants, and the purpose of the study will be explained during this time. Potential limitations. Injustice, violence, and crimes the youth have experienced or seen in their everyday lives could be a physical hindrance to seeking intervention support. With unstable living situations, societal inequalities in education and wealth, and threats of gang violence, there can be damaging effects if the teen's support system is not in place, and this includes family support as well as community supports. Also, limited information or focus on macro-level factors contributing to gang violence in Honduras could be a potential barrier. It could be significant to study and include the total mental and physical health impact of violence and trauma on teenagers in a gang, and what more can be done at a government or structural level to promote solutions. We have reached the conclusion of today's presentation. The goal of this research is to contribute to the field of global psychology, the literature, and increase effective policy and advocacy. The rise in gang violence and poverty is an international issue that influences the lives of the people of Honduras, and hopefully this research can promote effective interventions and strategies for change. The stories and experiences of those who were directly and indirectly impacted by community and gang violence could inform these interventions and address the ongoing crisis. By adding to the literature, support from international partners and stakeholders could be generated, and funding for additional evidence-based interventions and resources for the people of Honduras. This concludes the presentation. I have now included my references. Please feel free to review them. If you have any additional questions, comments, or concerns, I will be available to answer those. Thank you so much for listening to my presentation.